Stephen Jarrett, I'm the country lead for health system engagement at IQVIA for the UK and Ireland.
Hi, and I'm Hans Solgaard. I'm also in the healthcare team. We look after the patient data capture platform, and we focus on payer provider and also on pharma clients.
Yeah, so one of the key challenges that we often come up against when we're talking to certainly our pharma clients, but it's just as relevant to the NHS clients as well, is really that they often don't have a clear picture of, one, how their services are being delivered from the NHS side, but also from the pharma side, how patients are then interacting with these care services and these clinical teams out in the real world. And so a lot of the unique kind of capabilities we bring to bear from the healthcare team side is that we have access to sort of very granular data. But then the next thing is that it's all very well having the sort of clinical activity data, but we're then often missing component parts as well. And a really key element of that is how is that kind of service operated at the front line of care.
As a healthcare team, we've got a huge amount of information about patients in general, like I said, from HES, but also data we collect through the healthcare optimization benchmarking tool, but also through PLIX. And that's all information about the patient. We have information not just about the patient, but actually directly from the patient. So not just what do we know about you, but what do we know from you? Mm-hmm. What's your experience with the treatment, with the pathway, with the hospital provider, or with for example, the drug you're on from the pharma client, or what's the outcome? What's the difference in health state that we can measure based on your feedback to us as a patient over a period of time in terms of health state? We have a patient portal. A patient portal allows obviously the patient to log in. They can see what PRO instruments or the surveys they need to complete. It will give them information about the condition. They can see information directly on the back of what they've responded, if that's appropriate. And also it allows us through our insights platform that also is part of the solution, it allows us to manage that ePro collection period, really to see, well, has the patient completed on time? If they haven't, how do we reach out to them and try and engage them again? Is that a telephone call? Is that a nurse? If it's through the CSMS team, for example, that goes out and engages with the patient. But really try and do this from the patient's perspective and keep them engaged.